I want to talk a little bit in this module about some common complications that you might have after a cesarean section. So, if you have a cesarean section, you're going to be 2 to 5 times more likely to have back pain or pelvic pain compared with somebody who had a vaginal delivery. And it's important that when you have pain that we address it sooner rather than later. I don't want you to wait until you are in excruciating pain because it's just or something that you can't deal with. It's going to be that much harder to treat it the longer you wait. The sooner you get help, usually the quicker we can help you get back to normal. A physical therapist, especially one that specializes in pelvic floor or postpartum issues, can be a great resource. So can a chiropractor. Just make sure you reach out for help. So, you might experience postpartum bowel and bladder problems. This can be either vaginal or cesarean delivery, but let's start with bowel. So, that's pooping essentially. You might have constipation. So, you're either having a really hard time going or you're not going very often. You might also have incontinence. So, this can either be fecal or gas. So, you might be leaking poop or you might be leaking gas. When things are working properly, you're able to hold them in until you need to go. You kind of get a signal that you need to go to the bathroom, but things don't just start to come out immediately. So with incontinence, you might have some leakage. On that note, you should also be able to tell when you get that urge, whether that's an urge to poop or an urge to just pass gas. The third thing that might happen with bowel is you might have pain. So it might actually be really painful to sit down and have a bowel movement on the toilet. There's all kinds of reasons that can cause this. It can be your pelvic floor muscles are too tight. You might have hemorrhoids. Regardless if you're having pain with the bowel movement, I would highly suggest you see a pelvic floor physical therapist before that becomes more issues down the road. On the opposite hand, let's talk about some bladder issues you might have. You might have urinary incontinence, so leaking pee when you don't want to, essentially, when you're not sitting on the toilet, urine's coming out. Urinary incontinence can be lots of different things. It could be jumping, running that might make you leak. You might leak when you laugh or sneeze, when you cough. All those things are signs that your pelvic floor muscles are not working the way they should, and you need to get some help. That way, you're not leaking forever. While it is common, it is not normal that postpartum you're leaking urine. So, oh, I had children and 20 years later, I'm still peeing my pants. That's not good. And that's something that we can actually fix. It's not something that you have to live with. Another thing you might see is increased frequency of urination. So you might have to go to the bathroom all the time. I just went to the bathroom 30 minutes ago and now I have to go again. That's also not normal. It should be anywhere from 2 to 5 hours in between the times that you go to the bathroom. Now, obviously, if you had a gallon of water and drank some coffee within an hour time frame, you're going to have to go to the bathroom a lot. But normally, 2 to 5 hours is kind of that time range that we're looking for. All right, another common complication after a cesarean is going to be scar adhesions, and that's kind of what this course is going to focus on is minimizing and getting rid of those scar adhesions. So 50% of people who have a cesarean or any abdominal or pelvic surgery can develop scar tissue and tissue adhesions. So these adhesions can limit your strength and movement. It can be painful. It can cause infertility. I see a lot of people in the hospital that have intestinal obstructions, and when they go in surgically to fix that obstruction, they find a lot of adhesions in the abdominal wall. And what an adhesion is basically you've got lots of different layers of tissue that they have to cut through to get to the uterus. You've got your skin, you've got the fascia underneath, there might be a layer of fat, there's muscle, all these different layers. So they have to go in through those layers. And when they sew them up, sometimes when they heal, they stick together. Those tissues are made to kind of slide and glide as you move. When they're stuck, though, let's think of a tablecloth. So if you put a tablecloth on a table, if there's nothing on the table, you should be able to move that tablecloth fairly easily. It'll kind of glide on top of the table. However, if you take an adhesion and you've got, let's say, a cup, and I put that on my table, all of a sudden, right in that spot, it's going to be really hard to move the tablecloth. And you might be able to move it around it, though, but that one spot is kind of stuck. The more cups you have on that table, the harder it's going to be, and things really aren't going to start to glide. But if you take the cup away, we're going to be able to move things again. So the cup is like the adhesion. We want to take that away so that those tissues can move on each other again. With these adhesions, you are actually at an increased risk to have a miscarriage later on, uterine rupture. You might have difficulty with a second cesarean or any other abdominal surgery. You might also have difficulty with another labor, which can actually increase your risk to need another cesarean versus having a VBAC or a vaginal birth after cesarean. And then, like I said, you're also at risk for bowel obstructions in the future.